Hi, my name is Rocky Caravelli, and I'm an Ibogaine provider. I have been for 20 years. I'm the founder of Awakening in the Dream House, which has been continuously operating, sometimes slower than others, but we have been continuously operating for 17 years and done somewhere over 900 treatments without any fatalities. We haven't even had a medical emergency in over 10 years, and the one that we had was a guy basically overdosed himself, and we had to use Narcan to save his life. But um, what I'd like to talk about is Kratom and how, well, one, what a saving grace Kratom has been for the population of opiate dependent people because there is no other clean source. What we're seeing now is these huge, kratom tolerances of 80 to 100 grams a day, especially if they've tried to transition off of any level of fentanyl. Um, it's a hard transition, but people get stable, and within a few days they can kind of start putting things together. But it's tricky, and it's not hitting. It's like taking codeine when you're using heroin. Uh, I mean, that was back in my day. So uh, I'm eternally grateful that I am not part of the epidemic of street drugs that's going on in this day, because it just is just grim. There's just no good quality control substances, which would be ideal if the government would take some responsibility and make that available to people. But the point is, kratom is available, and people are calling and coming down for treatment for kratom. And when I first started hearing kratom, I was thinking, I mean, how far can you go with it? Well, you can go pretty far, is what we're learning. And then the little shots. If you do the little shots, then it like completely screws up your tolerance to the powder. There's not much of a high with kratom. I mean, you've got to really dig for it. You might get it in the beginning, and so it's a hard drug to chase to try to get a buzz, and then very soon you develop a tolerance towards it, so that makes it almost unachievable to be able to get a buzz, and you're just dealing with these massive tolerances and consuming these bags of like ground up leaves. Anyway, point being is that kratom is a little different than an opiate. Coming from an opium, whether it's heroin or oxycontin or morphine, or just plain opium. It's a little bit different alkaloid. We don't treat it directly with the ibogaine. We transition for 3-4 days, especially if they've been using the whiter green strains of the kratom because of the stimulant properties of it, and ibogaine being a stimulant, and it can have some interaction. And anyway, we like to have the body as clean as possible going into treatment, and it's our preference to be on something simple like a morphine alkaloid, because iboga and opium seem to be kind of friendly towards each other. They're certainly not enemies like with methamphetamine. Iboga doesn't like methamphetamine at all, and it will kind of tolerate cocaine, but not very well. There's several stories of people taking a hit of crack and on iboga and their heart stopping. So, of course, that's the big concern. This whole thing about the safety of ibogaine. You can't mix anything with it. Period. That's just the deal. So, what we've been doing and how we've been able to actually bring people all the way off kratom and literally be able to sleep every night, eat every day, be able to be up and about is we've been doing it in stages. And we try to find a rhythm for each individual. So this is all done per person. This is not a standardized protocol. And we can work around. We can really work around how to bring somebody off of any opiate addict, let alone kratom. But kratom's been, was the most recent one, and the one that we were talking about with friends today. And he said, Rocky, you ought to do little recordings and just post them and see if they attract some interest. So that's what I'm doing today. And this idea of what happens when you start to use the kratom shots is just you're never able to achieve that level of stability, because once that level is established through the extract of the kratom, um, the powder is just, you're just walking around with a thermos 24/7. So this is something I just wanted to share. Like, our work with the kratom is interesting. One of the things that's also kind of mysterious about it is right around day 10 or 12 post, since we've been beginning treatment. And what we do is we'll work for a while, with the Ibogaine, and when we restabilize in real low doses of morphine until that person's like restabilized, let's put it that way. It's not something that we like to promote or anything, but it is achievable and safe, and that's the main point, is to try to keep people safe and cared for, and to be able to do an opiate detox without such severe sleeplessness afterwards. So Ibogaine takes care of, all the major withdrawal symptoms, but you are raw as a baby because the endorphins are gone, and you can't sleep. So we've been able to actually reduce tolerances over the course of 12 days or 14 days, depending on the individual. And that last step off, so we'll get down to 90% of the detox, and in that last step off isn't this dramatic, flood type experience of taking the Ibogaine and going from a high tolerance to a zero tolerance overnight. That's the way I was treated, and that's how we did it for years. I mean, we didn't know that we could work with it this way. So I've been really fortunate to be able to explore and work with this medicine in many different approaches and utilize it according to each individual. There's not a standardized cookie cutter, treatment guideline that's efficient or effective for everybody. So, as far as being a provider and what that means is, like, I'm working with each individual and our staff and everybody, and so we take into consideration all these things. So this thing at about day 10, this bubble that will pop out of nowhere, and all of a sudden you have this like person that's exhibiting, teary eyes and sniff, like onset of first stage withdrawal symptoms after, being stable all during this time of retransitioning and, taking some medicine, reducing the tolerance, going back on a stable opiate, and picking it back up after they sleep a night and eat and hydrate, make sure that their magnesium and potassium levels are all maintaining. So that's where problems happen. So if people are able to maintain taking in the supplements and the electrolytes and the calories, and being able to exercise and sleep and be able to do these things, this is actually a very humane treatment now. It's always been a humane treatment in comparison to cold turkey, but now we're actually being able to refine Ibogaine treatment and detox in a manner where we really get to work with each person and what their capacities and tolerances are, and it's allowing much more time with the medicine in their body for them to do introspective therapeutic, or one discharging trauma, because that's all energetic, and in the end we can do a flush to really reset the obsessive compulsive neural network that's been designed as a result of the exposure to drugs, that is grown and that is in place. So even if you stop taking the drugs, that imprint is still there. And so we have to do a flush of a certain specific dose in order to break that. And then, of course, the noribogaine provides the neuroplasticity, and it restores and rebuilds new neural pathways so that the body can feel on its own again without having to supplement it with drugs. So this is kind of like what our main focus has been on, and that we want it to be in a holistic setting. And we have our medical, support team, and I trained in a medical detox, so it was like, we're not cutting corners, all right? Because I'm not going to be around for 20 years and work with hundreds and hundreds of people and be able to do them safely unless you follow some guidelines. So I'm just wanting to share this information with people and open it up so that maybe people can ask questions. I'll try to post this on YouTube, and I'm going to continue to have topics of discussion. And if anybody would like to hear more information about different topics surrounding Ibogaine and Iboga therapy, feel free to leave one in the comments. Again, awakeninginthe-dream.com is our clinic here in San Miguel de Allende. And my name's Rocky Caravelli, and just wanting to open it up and share what we've been experiencing. And today's topic was Kratom.